Good afternoon, everyone. It is definitely an honor to speak before a group that are so expert in this field, so committed to this field, and so enthusiastic about coming together now in Boston to see where we're going. So I've titled my perspective that I'm sharing with you today, and that we want to put forth to the community of obstetricians and gynecologists as we reflect on the contributions and the milestones we've made as humanity with walking on the moon, and the transition now of Neil Armstrong is in the 24-year journey. Where have we started, and now where have we landed? And so this is my perspective in obstetrics, which I've now been practicing for 11 years. Firstly, we look back, and I think it's important to appreciate that in the 20th century, cord blood banking was an entirely different entity than it is in the 21st century. 20th century cord blood banking was involving cure of hematologic disorders and cancers, immunologic disorders. Certainly, there were no federal or state legislation that were already passed regarding policy or regarding funding. And the ACOG committee opinion was severely lacking in its encouragement of OBGYNs. So that in 1997, the ACOG committee opinion gave no clear recommendations as to how the conversation between physician and patient should be conducted, and largely viewed cord blood banking still as being unproven and experimental. So that's where we were in the 20th century. And certainly the 21st century offers great advantages to that. We're not at all where we used to be, so that now we have over 70 treatable diseases using the cord blood. Over 10,000 transplants have been successfully performed worldwide. The Stem Cell Therapeutic and Research Act of 2005 was passed. Over 20 states, including my state of New Jersey, have passed legislature, at least regarding some level of a policy statement regarding cord blood banking. And finally, ACOG came around and updated their committee opinion to be more up to snuff, so that they no longer viewed cord blood banking as experimental, and were able to say that there are benefits when there is a related donor. So there's certainly benefits to a family being encouraged to privately bank. And they actually encouraged that physicians should provide fair and balanced information to patients upon request, was the important caveat. A lot of the state literature, state legislation, excuse me, does not say upon patient request that the information should be provided either by the physician or sometimes by a state entity to all patients that are expecting. So here I am, committed to cord blood banking. It is a very simplistic thing for a board-certified obstetrician, a certified nurse midwife, to perform at the time of delivery of a baby. If we look at our present United States landscape, where we stand, and many of the other speakers have spoken on this topic as well, it's important, particularly this body of people, to appreciate really where we are. So my perspective as an obstetrician is that we have the National Marrow Donor Program Registry. And in this registry, only 30% of patients in the United States are going to be able to successfully find a match. So that means over 2/3 will die. And although we have not been able to and are not likely to be able to fill that registry with bone marrow donors, we absolutely are delivering 4.1 million babies into the United States every year. And therefore, we have a resource already at our avail. We simply are not using it. Less than 5% of all U.S. citizens that are giving birth in a given year are banking the cord blood. And this is despite the fact that over 400 transplants are done successfully every year in our country. So we now, very different from what we had in the 20th century, we have a disparity between what we're able to do, what we're proven to do, and what educated Americans seem to be aware that we're able to do. So as a physician, we take the Hippocratic oath. And that oath has always been thought of as first do no harm. But I think it takes on a new reality in many areas of medicine, including in the area of cord blood banking, when it comes to the 21st century. And it has to translate into, do not allow the patient to stumble into harm due to a lack of up-to-date comprehensive counseling. By the time a family realizes that cord blood banking could have changed the fate of the family, could have saved the life of the child, it's too late. And I think it's only a matter of time before our litigious society, this will be a very negative, blameful feeling upon the obstetrician.
I've begun a program called Taurus Angels, in which I want to encourage public donation of cord blood to the public bank. In our National Marrow Registry program, we have 70% of patients not able to find a match at all, and those patients will die. And we are continuing to throw placenta and umbilical cord blood into the garbage.
Please welcome Dr. Afriye Amerson to the show on her. Because you know what, I have these three moms that are here that all have questions, and I thought, you know what, I better bring in somebody, the big guns, to see if I can help answer some of them. Well, you gave birth the first time 15 years ago.
Yeah.
So,
not really, but it's all new.
All new. So all the things have kind of changed, or have they, Doc?
Actually, things have changed drastically in the past 15 years.
More C-sections under that for a fact. Why is that?
So I am showing you this clip just as our real demonstration of the fact that we as physicians need to be talking about cord blood banking. We need to step outside of the white coat. We need to step outside of our offices and get involved in this issue as a policy matter, get involved in this issue as advocates, and it really ultimately will change how our patients see us relative in society. So I have been very active as an advocate of cord blood banking as a physician, recognizing that I'm the most trusted physician in my patients' lives. What that means is they trust me more than their internist, their dentist, their orthopedic surgeon, whomever. I am their most intimate physician, and therefore I take that on as a responsibility. I have a responsibility to make sure that the education that I have regarding cord blood banking has been provided to my patients. So it should be important to all obstetricians. All are not going to be as altruistic as I see things even after 11 years. Grace of God, I have not been sued yet. I have not been through many of the experiences that I think cause my colleagues to become very jaded, very bitter. But my philosophy is either be in it and love it or get out. And the problem really is that our patients aren't stupid. They pick up on body language. If you're burnt out, they know it, they feel it, and so you've already created a hostile environment. Give everything or get out of the game. Obstetrics is not something where we can half step. So even for those that are not altruistic, brain injury is a reality in the lives of every obstetrician. It is a major, major cause of our medical legal malpractice crisis. So we need to appreciate the value of cord blood banking when it comes to the prevention and the repair of brain injury. 1 in every 500 children in the United States is diagnosed with cerebral palsy. So obstetricians have no reason to not be talking about cord blood banking to every single patient. One of our cord blood banking companies has a low APGAR protocol for cord blood collection, meaning if the 10-minute APGAR is less than 3, the family will not be charged to bank the cord blood and tissue for 5 years. Okay, because the high likelihood of brain injury, if not cerebral palsy, for those children. And the same is true for premature and severely premature children. I keep kits in my office. Kits are kept at the hospital where I have privileges, such that you have a bad tracing, you have a patient who comes in severely premature and you're expecting delivery, you pull out the kit and you begin the discussion, even if it has not previously happened. I think that rather than viewing the discussion of cord blood banking as an additional burden, it is logical that, as I said in the Montel episode, a lot of things have changed in 15 years. You saw the mother who, that was her last time delivering, and I have a lot of those patients that when they come in, a lot is different. We're going to be doing genetic screening that you probably didn't have in your previous pregnancy. We're going to be doing genetics counseling. Many of you will be referred to a genetics counselor. And we're going to talk about the value of prenatal counseling and preventive health. And so this is where I bring in the topic of cord blood banking. And families are very, very receptive to that, very absorptive of the information when it's presented in that fashion. Discarding is not a choice, it's a lack of a choice, much like unplanned pregnancy. So I explain to patients that there really are 2 choices, or you can fail to make a choice at all. If you choose to donate publicly, that this is at no cost, and you would be surprised how many patients don't know that. The ones who are vaguely familiar with the concept of cord blood banking are immediately turned off because of cost. It doesn't even occur to them that they can make this donation. And you saw I started an organization, which I could spend another 5 hours telling you the obstacles in public banking, and I'm so happy that our conversations today have been rich in that. But the organization was to raise awareness for public donation. And in that organization, as we raise awareness, one of the main philosophies that we taught is that your child, their self-esteem is impacted when you let them know that their cord blood was publicly donated and that upon their birth they have actually contributed to, if not saved, the life of another human being. Private banking, I think we've all gotten good discussion on that. It is initially expensive, but it's a tremendous investment in your family. There are higher survival rates. There is lower graft versus host disease, and it's readily available, unlike bone marrow. So the Parents' Guide to Cord Blood Banking is an organization that was founded by Dr. Fran Verder, and I'm very, very proud to be one of the advisory panel members. This is a non-directive, unbiased, informative website that provides regular newsletters. It's great because many times we have, of course, the brochures from companies in our office. But again, our patients are highly intelligent, and they will say, well, yeah, but it's from the company. Of course they're going to say that. They want unbiased information, and so this is a phenomenal resource for them. And again, the Scientific Advisory Board are the leaders really in this field, and so it's an extremely sound base of information for Americans, and hopefully we can get that 5% knowledge base up through actions such as Dr. Verder's. Again, the limitations on public banking are extraordinary. Again, I've been through just many personal devastating situations of encouraging all of my patients to publicly donate. You know, I remember saying to myself, over the next 6 months, no one's discarding. You know, so either they're going to privately bank or I'm signing them up to publicly donate, only to find out that there's no funding. And my state blood bank is not even collecting from my hospital anymore. Forget about it. So only through collaborations do any patients out of Hackensack Hospital, which delivers over 7,000 babies a year, only through collaboration do they have any option to publicly donate, and that is pathetic. And again, the advocates for that really should be coming from the medical community. So ultimately, it's a simple 3-part, 5-minute discussion with a patient during their pregnancy. So again, with organizations like Parents' Guide to Cord Blood Banking, just hand them a brochure, hand them a newsletter. It's very simple. You have opened up the knowledge base. They are all literate, so it's fine. Then at 26 weeks, this is when they're getting their glucose testing. Again, studies have shown that over 70% of patients will make the decision to bank the cord blood in their 3rd trimester. Furthermore, that's when they're seeing us the most frequently. So at week number 26, begin the dialogue. And I love doing this with my patients. I get to play teacher like my mother is. So I go, now, did you do your homework? Let's have a discussion about what I gave you to read. And then at 36 weeks, you ask them what decision they've made, not if they've made a decision, because now, yeah, they have actually made a decision, even if it's non-decision. And ultimately, I leave us to all reflect on that which is unknown. And that which is unknown, quite frankly, and what I say to my patients is the lifetime probability of use. Because the child that I'm bringing into the world now, the children that are due in April of 2013 that I've already seen on the sonogram, will be able to experience benefits potentially of regenerative medicine, of their own longevity of life, and the changes that that will pose to the human biology and physiology, and the expansion of stem cells that have already been collected. And this is going to change their reality. And this is another part of what we need to be instructing patients, that if, again, where we started and where we landed in 24 years has been exponential, we can only expect for that to continue. Thank you for your attention.
Okay, we have time for a couple of questions. Yes, Michael.
Thanks for the presentation. I do agree that we need to make sure that mothers are given all of their options up front, so I really appreciate that message. I am a little concerned, though, that when you said that only 30% of the people have a chance of finding a donor on the National Registry, that is not correct, and I want to make sure that we communicate that differently. So I'd be happy to provide some information for you to show. I think that no individual would, every individual has at least a 60% chance of finding an acceptable match in the adult donor side. If you add cord blood to that, it goes up to 80%. So we think that the statistics being used on this are probably a little erroneous, but I don't think it changes your message. I just want to make sure we use the right data. Thanks.
You were talking about cord blood.
Okay, yeah, that would be good information, because those are the stats that are frequently quoted, and as a matter of fact, quoted as lower for certain ethnic minority groups. So I would love to see more encouraging information.
So the stats I've seen, actually, Michael, correct me if I'm wrong, there's a different set of stats if you just look at what's available for cord blood as opposed to bone marrow and peripheral blood. There are lots of folks available. It changes dramatically when you fold in peripheral blood and bone marrow, right? Absolutely. Yeah. So you may have been thinking about the stats for cord blood as a tissue source. Mm-hmm. Yeah. Okay. Guy.
Just very quickly, do you have any views on delayed clamping? In the UK, this is becoming quite a big issue now, and I'm interested to hear what the American experience is around this.
I don't think I'm the best person to speak on that, because personally, I have observed no difference whatsoever. I have not found that I'm collecting significantly more if I delay the clamping at all.
Roberto.
I'd like to add something. We always talk about the difficulty of finding a matched donor for minorities. And again, bringing my country's perspective, in Brazil, 43% of our population is mixed race,
Right.
is undefined ethnicity. So it's a completely different ballgame when you're talking about matched donor. It's very, very difficult. And then private banking plays a special role. Just wanted to add that comment in.
Okay.
That's very important. Thank you.
Phyllis, did you have a?
Yeah, I was just going to ask you, stepped out for a minute, so I hope I didn't miss it. Granting that collection isn't rocket science, nonetheless, there are a lot of different things that can go wrong during cord blood collection. Is this part of residency training for OB?
That's a phenomenal question. To my understanding, it is not something that is formally in the curriculum, but it is something which residents are being exposed to. So it would be extraordinarily rare that a resident would be able to get through their 4-year training and not have repeatedly collected cord blood. But is it an itemized list that should be checked off as a part of them completing their residency requirements? To my understanding, no.
So it's not necessarily something that they would have consistent training in. I think one of the challenges in family banking, at least, especially, is documentation that the person who's doing the collection has been trained and how they were trained and what kind, just all the things around that would be useful for them if they could say, well, I'm board certified.
That's right. That's a wonderful point. Thank you for that.
So I have a last question.
Yes.
You've obviously drunk the Kool-Aid and believe that cord blood is a very viable source of tissue and one that's beneficial to store. I think a lot of folks in the private banking business has found that a key influencer in whether tissue is stored or not is the OBGYN. Do you have advice for folks working in the either private or public banking how they might be able to persuade a greater number of OBGYNs to encourage their patients to store tissue? What ultimately influences, in your view, the OBGYN to decide, yes, to recommend to the patient, yes, you should store mom and dad, or no, you shouldn't?
That's a very difficult question. Even when I started the cord blood banking awareness campaign, I utilized nurses. I specifically utilized nurses as the community advocate and the beacon of education. I would be interested to hear what some of you guys have tried and what your experience with my professionals has been, because honestly, I think the apathy is at such a level that there's already a financial incentive. You get a minimal amount back, but that's more than you're going to get for any other medical procedure that you're doing. And I presented how you're really saving your own skin in encouraging cord blood banking, but these things are not effective. So, when I interpret your question, it's real effect. How can we get real effect? And I remember in the early 21st century, several cord blood banking companies were really very actively educating physicians, flying physicians to cord blood banks to tour and to visit, to really just build what I have, which is just enthusiasm. And that did not work.
Yeah. Okay. It's a tough nut to crack.
It is.
All right.
Can I just end by saying I thought that was a really refreshing presentation. Thank you so much. And if I could clone you, I'll take one of you back from you.
Oh,
I think we all would.
That. I appreciate it. Thank you.
All right.
Have a wonderful conference, everyone.
Thank you very much. I'm sorry if I wrecked your name. I apologize.